Hello and welcome to this evening's discussion on maintaining your mental wellness during the COVID-19 pandemic. Our presenters are gynecologist Dr. Victoria Leiphart and psychiatrist Dr. Seema Sehgal, both whom are experts on well-being. Without further ado, please welcome Dr. Victoria Leiphart and Dr. Seema Sehgal.
Hello, I'm Dr. Victoria Leiphart. It's my pleasure to interview Dr. Seema Sehgal tonight. We're going to talk about your mental wellness during the COVID-19 pandemic. This has resulted in a lot of societal changes for us. With the shelter in place, this has increased people's anxiety, and we've become accustomed to things such as physical distancing, as Dr. Sehgal and I are tonight, and to wearing masks in public. Many of us have found unhealthy ways to manage our stress, such as eating poor food. I confess to some quarantine snacking of my own. Excess consumption of alcohol and drugs, and binge consumption of news and social media. Dr. Sehgal, can you please address some healthier ways that we could manage our stress in this time?
Sure. I'm so happy to be able to do this. These are certainly unprecedented times. And sometimes it is the uncertainty about our situation, the uncertainty about illness, rather than the illness itself, that can cause an enormous amount of stress and fear. Now, we must remember that feeling some amount of fear and anxiety is absolutely normal. It's when that normal protective anxiety begins to spin down into panic and dread is when we need to take note. If you find yourself ruminating constantly, you're catastrophizing about things, that's time to sort of, stop and pay attention to what's happening to you. Now, a few ways to handle the stress, just as you mentioned. When stress creeps in, Dr. Leiphart, good habits creep out. And so what we really need to remember is try to give our mind the gift of predictability. And we can do that by sticking to routines such as good sleep habits, sleeping on time, waking up on time, feeding ourselves good nutritious diets. Now, I know it's hard when we're all cooped up at home. There is that instinct to reach for high carbohydrate snacks. Once in a while is okay, but you don't want to make that the mainstay. Staying away from alcohol. I know alcohol and drug use is up. And so if you sort of find yourself reaching for those substances, take a moment to sit and see what it is you're trying to medicate. Trying some mindfulness exercises are very helpful. Trying to exercise daily, even 15 to 30 minutes of a good walk in the sun does wonders for your mental health. So these are some of the ways that I would deal with the stress.
Yes, I have definitely found that what has kept me sane is being able to walk in my neighborhood, see the blooming flowers. I take pictures every day. The wallpaper for my cell phone is a picture of a flower from one of my walks, and it's made a huge difference. Can you talk about some of the changes that the shelter in place has created for people? For people who live alone, a lot of them are suffering from significant loneliness. For people who live with family members or friends, they have the opposite. They have a lack of personal space, and this has caused some increased friction. Can you address some of those changes?
Yes. As you mentioned, I think just as human beings, as a species, we are very social creatures. And loneliness, isolation, this social distancing doesn't have to mean a social detachment. And so, I'm trying to reframe it for myself and thinking of it in terms of a physical distancing, but reminding myself that it's time to pay more attention to remain connected to those that I love. And there are, populations that are at higher risk for really having symptoms of depression or anxiety secondary to the loneliness. And those populations tend to be either the elderly who are alone, who are living in nursing homes or care facilities. I had a patient I spoke over the phone with last week who actually cried on the phone and said, "I'm afraid to die alone. I'm afraid my family is not going to be able to visit me, and before this is all over, I will die." And so just to hear that degree of panic and sadness was something I really took note of. So, for families to reach out to these vulnerable populations, your family members, your parents, your grandparents, is important. To give the grandparents a sense of purpose, get the grandchildren connected with them. The two extremes, I think, can be wonderful supports for each other. And to stay connected with these vulnerable populations in our own communities. While taking a walk in my own neighborhood the other day, I saw a few of the children in the homes had made these beautiful letters and cards for their mail carriers that they had pasted on the mail boxes. And I thought that was such a wonderful reminder for the mail carrier, an essential worker who otherwise would go unnoticed, to take that minute to recognize them. So I think what we are really missing right now is recognition. And if in some way we can bring that back in the ways that are strange and novel for us, would go a long way.
Can you address some of the things that we can do to stay socially connected? I agree with you. I have stopped saying social distancing and I say physical distancing because I think that there's a difference. Yeah. For example, I'm doing a lot more FaceTime than I've ever done in my life. And my meditation class meets on Zoom. I've attended a lecture on Zoom, and my book club is now meeting on Zoom. Can you address ways to stay socially engaged when we are socially isolated?
Right. And, that takes just a little bit of mindfulness. One, to realize its importance, because we know that loneliness kills. It really does. People say that being alone and lonely is like smoking 15 cigarettes a day, and it is worse in terms of outcome from diabetes or hypertension or smoking itself. So we really need to encourage people to reach out to people in any way that they can. And thanks to the technology available to us, Zoom, we probably haven't heard the word Zoom as much as we have in the last 6 weeks. I barely knew Zoom existed, and now it's as though my life depends on this 4-letter word, and I'm grateful for that. So other simple ways are just doing FaceTime if you have a smartphone, just doing FaceTime, using Skype, using social media in ways that, doesn't sort of deify it. We are no longer, it's not the monster. In fact, it's coming to our rescue. So using Facebook, using instant messenger, and if you have none of that, a good old-fashioned phone call will do. Even a letter, if you're on a walk, make a handmade card for someone, write a few words in it, and send it the old-fashioned snail mail way.
Yeah, I've found that to be very helpful. My elderly parents and in-laws are in lockdown and very isolated, and calling them regularly has been good for them, but also good for me. It reassures me that they're doing okay.
Yeah. These are difficult times because we have so much stress, not just from the uncertainty of the illness itself, but people are struggling economically, financially, the distance from families, worries about grieving lost ones, your loved ones, so many missed opportunities for graduations and, birthdays and weddings being canceled. This is a tough time for everyone.
Speaking of graduations, can you address kids, how they're handling this, and how we as parents are handling having our kids not in school?
I think that probably has been one of the most difficult aspects of the shelter in place. When I speak with my patients, especially where both parents are working and they have young children now at home who have to be supervised for their distance learning, and their childcare has been stripped away, it's really difficult for couples to compromise, to work together, to come up with some working solution for making it work for everyone in the house. And so with children, it's sort of a unique set or a unique group of individuals. Teens are difficult even in the best of times. Being a teen is not easy. And being a teenager at this time is, I think, really, really hard because, their social life is so connected to their school, and having it stripped away and being isolated at home, distance learning, sort of sequestered with your parents from whom you look forward to spending about 8 hours a day away from is very hard. So realizing that this is a big shift for them and being sensitive to the need for their downtime, their alone time, the need for reassurance, the need for them to feel stressed and anxious, and for you to say it's okay and that you are feeling it too, I think goes a long way in helping sort of alleviate their anxiety.
And you have teens.
Yes.
How are your teens doing?
My teens, knock on wood, I have a son in college and a daughter in high school, and both of them are home and both doing their distance learning. And, they have their anxiety, especially now that we are hearing about the shelter in place possibly being extended, some states opening, some states staying closed. There's so much conflicting information, and they so want to reclaim their lives as they knew them to be. So there is, a lot of anxiety, and I make sure that I talk to them about it, not just once, but on a regular basis. Reassure them, remind them that they are in a safe place. We are taking all the precautions to keep them safe, reassuring them that this is going to pass, which it will. And sort of, giving them those resiliency skills, helping them build that. After all, resiliency is just a set of skills we need to move through adversity without breaking down and having growth through it. So keeping the focus on this being in some way a learning experience is great. And also encouraging them to write a journal, to keep an account of this very unusual and unique time that they're going through. In fact, today, just as I was coming for this discussion, I told my son that, pretend like you're writing a letter to your grandson. And, my son is only 21 years old. And I said, address it to your fictional grandson. And what would he like to know about this time that you're going through? So giving them a different perspective often helps.
And there's a lot on social media about getting to do all those do-it-yourself projects and all those things that you've said forever that you'd get around to if only you had time. Now you've got time,
Right.
and you feel that you should be doing those things. I've got all sorts of projects at home that I feel like I should be doing now that I have extra time at home, but I find that I'm doing none of them. And one of my girlfriends said, this is not normal time at home, and you have to be gentle with yourself and forgiving towards yourself that you are not accomplishing what you think you should be doing.
That's right. And, I think you really answered your own question in that, these are very unusual times. So the usual standards to which we hold ourselves have to be modified. And, people who, again, have that flexibility, adaptability, the resiliency, are able to see that the most important thing right now is to treat ourselves with kindness and compassion. That this is a very difficult time, and even though we physically may not be doing a lot, the mental strain the mental stress of this is exhausting. And again, our mind is, trained to look for patterns. It feels good when there's predictability, when it can recognize what's coming next. And we are living in a time where day to day, information that it has to process keeps changing. And so the mind is working really hard. So to give yourself, cut yourself some slack, take some downtime. It's okay to not do the things that you thought you would do that day.
So now I'd like to open up the forum and take questions from our audience.
Okay.
Thank you. I have a question. My daughter's personality has changed, and she's not acting as before. What are the psychological challenges that I should be watching out for?
Children will manifest symptoms of depression and anxiety different from adults. In them, the things to watch out for are irritability, a withdrawal, and unwillingness to talk about things that have to do with the stresses or any other things, a withdrawal from their schoolwork, not paying attention, no focus, no attention or concentration. So these could be signs of emotional distress and should be watched for. And if they're occurring on more days than not, then it's time to sit up and get some help for it.
Next question. I am caring for my 94-year-old mother. She is showing signs of depression. How can I keep her engaged?
As we were speaking earlier, the elderly population, I think, is affected in a very unique way. As, another patient told me the other day and said that, do you think I'm going to outlive the COVID-19? Will this be over first, or am I, going to die before it? So there, given that at that age and stage in their life, the one thing that keeps them going is the connectedness. It's the social connection with family. It's having them all around them. And to have that stripped away for whatever reasonable reason is very hard emotionally to digest. So talking to her, if she lives with you, making sure you spend time with her. If she's living away from you, making sure that you're reaching out to her via phone or any of the other, social media or other technological means that we have available, and reminding her that she is so strong and she has been through so much in her life, and this too shall pass. And reaffirming that you love her, that you care for her, and she's an important part of the family, and how much strength you derive from her. So again, giving her a sense of importance, of hope, I think would go a long way.
And for parents of that generation, and my mother-in-law and stepdad are of that generation, they went through World War II. Right. And asking our parents what coping strategies they had then, what might be relevant now that would be helpful for you, allows them to, it reminds them of a time when they were strong and resilient people. It allows them to share that wisdom, that legacy with you, and it can be helpful for both you and for them.
That's true. That's true. In fact, one of my friends, who is a woman in her late 20s, said that she had actually started this project with her 91-year-old grandmother and learning recipes from her that she had never previously had a chance to learn. And so through, just the Skype, which, the poor grandmother had to learn, but she did, she's learning all the family recipes, things that she didn't have time to do before. And it gives such a sense of meaning and value to the grandparent.
Next question. How do we ensure developing minds not to sink into social media addiction?
That is a good question, because there's the fine line between, the burnout. There's a new term being coined now. There is something called screen out, because people are spending so much time on, behind the screen. And I, in fact, had to approach the administration of my daughter's school, because when this first started, the shelter in place started, we weren't sure how long it was going to be effective for. And I soon realized that she was spending close to 12, 14 hours just doing her regular school day, and the requirements of homework and after school activities, everything now being online. And then you have the socializing which is happening online, you have your news information, everything is coming online. So again, this is a time to be flexible with your children, because it is a lifeline for them in so many ways. But I would definitely, help them in taking out pieces of that are not helpful. So you don't want catastrophizing news alerts, just pinging your phone every now and then. I would probably watch the news together with them, so that if there is something, you discuss it together. And telling them, use it in a way that actually helps you get through this in a healthy way. And you have to do that sometimes, I think, by example. We cannot preach what we don't believe in.
Right. I like many people, have spent much more time reading news articles than I have at any prior time in my life.
Yeah. So it's a balance, I guess.
Right. Mm-hmm. Next question, Lucy.
That leads actually to the next question. So with so much news coverage on the pandemic, do you think it is helping us or hindering us into living into fear?
I think that we all have to watch enough news to be informed, and to feel that we're educated citizenry. But when you're scrolling for more than an hour or 2 hours, reading news feeds, reading news articles, you're consuming too much news.
Mm-hmm. I agree. And what that gives the mind, it gives it fodder for worrying. And worrying is an act. It is not a passive, emotion. It takes up energy, and it can make anxiety and depression much worse. And so, when we speak about self-regulation or self-discipline, self-mastery, that all of that speak to being very, very good gatekeepers of how much news is enough, what sites are you getting your news from. So I will pick 1 or 2 reputable sites, and I will check them maybe once a day, at most twice, but once a day I feel is enough. If there is something that I really need to know about, I'm sure I'll learn about it. So that's something I have just decided for myself, that I do not need to check the news any more than that.
Right. I would definitely second choosing the sources that you get, because for Dr. Sehgal and I, we're physicians, we're scientists, and learning the science of what's happening in the pandemic is useful for us and of interest to us.
That's right.
But I find that I am doing more reading of academic papers and less consumption of just general news sites.
I think this was my 16-year-old who told me today, in fact. I asked her how she was doing emotionally, and she said, "Mom, I'm educated. If you depend on history and science, you can never be anxious." And I thought she had some value to her words right there.
Thank you so much. Well, this concludes our program. So thank you again, Dr. Leiphart and Dr. Sehgal, for your expertise. And thank you to our viewers for tuning in. The entire broadcast of tonight's event will be available on our Facebook page later this evening, and we look forward to hosting more Facebook Live events in the future. Thank you.
Thank you.
Thank you.